Hello, this is Dr. Ranjeet Bajwa from Buena Vista Optometry in Ventura, California. I wanted to talk to you about some interesting news recently about recent spate of infections in the London area. A lot of news has been coming out about the increased risks of Acanthamoeba keratitis. Well, what Acanthamoeba keratitis is a protozoan infection of the cornea, the clear portion of the front of your eye in front of the colored part of your iris. It's not very common, but it does happen a bit more frequently in our contact lens wearers. The symptoms are usually redness, pain, severe sensitivity to light, and watering. And also, it can be a very difficult disease to treat, and it usually takes somewhere along the lines of 6 to 12 months of treatment, fairly frequently with drops. And even at that point, there can be scarring to the cornea that can require a corneal transplant. So not very common, but a very, very severe issue if you do encounter it. In the news, what they had found was at Moorfields Eye Hospital in London, England, there was a 3 times higher incidence of this type of infection just within the past 10 years. In 2003, the frequency was about 8 to 10 cases for the entire area. By 2009, it had increased to 16 to 20 cases, and by 2013, it had jumped up to 65 cases that year. In the US, it's more commonly to occur in 1 to 2 people per every million, so less frequent here. And the reason for the high incidence of occurrence in London is likely associated with the way that they store their water. The protozoan can get into the water, and what we find is for our contact lens wearers, especially those that are cleaning their lenses or their cases with tap water, that's where this infection can occur. So how does this affect you? Contact lens hygiene is always very important. We are strongly encouraging our patients to wear daily disposable contacts, but those that wear 2-week or monthly disposables across the board, keeping your hands clean when you're working with your contacts is very important. You should not ever use any tap water on your lens or on your case, and for those in reusable lenses, we do recommend replacing your lens once every month. For all contact lens wearers, we don't recommend swimming or bathing in your contacts or even getting them wet if you can avoid it, because that is how things get into that contact lens, underneath the lens and into your eye. What do you do if you do have these types of symptoms? It's very important for you to see your eye doctor, your optometrist, as soon as this starts to occur, to rule out these types of infections, because although your eye has a tremendous ability to heal itself, these are the types of infections that can lead to permanent blindness. We want to get out ahead of that as much as we can. If you ever have any questions, anything you'd like us to answer for you, you can always reach us on our website or via email. And I am on Twitter if you want to reach me at Dr. Raj Baj. Happy to answer any questions that you may have. Look forward to talking to you again soon. Take care.